Hi, everybody. No disclosures. You can get covered for lipedema surgery if you can find your rights in the full version of your benefit plan. Not the simple one they send you out, but you ask for the full version and it will tell you what's covered and how to do an appeal in detail. Mine's called evidence of coverage. Look for your rights to have liposuction as not cosmetic. You know, every plan tells you you may not have liposuction surgery because we consider it cosmetic surgery, period. However, there's an exception. In my plan, it says we cover reconstructive surgery to correct abnormal body parts caused by a genetic defect. And we will correct them to improve the function of the body part and return it to normal appearance. That's exactly what we need. Sometimes they even define a functional defect as a pain that interferes with your daily living. So this can be easily proved for some of us. Some plans also cover errors of fat metabolism. Isn't that what lipedema is? Metabolism issue. They also say it's not medically necessary, but define it as needed to treat the progression and the escalation of a disease. And if you have that right to treat your disease and prevent it from progressing, it's in your contract. If your network physician decides that there's no way you can have this in network because they don't cover it, my contract gives me the right to go out of network. And if I go out of network, I only have to pay the copay I would pay if I was in network. So for me, my copay was $200 per surgery, but yours could be different. Look for your rights to get timely decisions. And if they say that you self-referred to a surgeon out of network, which mine did, you just come back with, I have a right to participate in my medical care. And so when they give you an argument, you give them one right back. Sometimes you have to pay for your surgeon up front. So I found wording in my contract that says if we have to pay up front and it's found upon appeal that it should have been covered, we'll pay you. However, when I submitted my bills to get reimbursed, they said, nah, we don't cover this. So I had to go through another whole appeal to get my bills reimbursed for surgery. But you can do it. After you know your rights, because that's first, gather all your medical evidence. Get your doctor support, any doctor in your medical plan that will listen to you about lipedema and support you. Get your letters of medical necessity. Here's an excellent article that Herbst and others wrote on medical conditions that do accompany with lipedema, so you can use some of those conditions. Lipedema surgeons, you pick one that's best for you. Find the best fit, and then you proceed with how to get paid. Either you do it or they do it. Ask for a reauthorization, pre-certification, and the surgeon will write up the number of the plan of how many surgeries you need and all the details that should be in the codes and all that. Expect to be denied on pre-certification. 90% of the people are. Don't stop. You appeal, and you request the records that they used in making their decision, because sometimes they say things that aren't true in there that they send on to the appeal committee. Or, you know, they just have an opinion that it's cosmetic and that's it. Gather your research information then. So Simone Kramer has got an excellent Facebook group on research articles that you can go on Facebook to get. And of course, the Fat Disorder Research Society has lots of speakers or information, and they will find you experts that you can quote. Educate the appeal committee about your lipedema. Pretend you're writing a research paper. Get someone to help you write the paper. My wonderful husband helped me organize my paper, so he was my support. Here's you're going to tell your medical history and your photos and address their points of denial. I have put examples of some of my papers in a Google Drive file, and this is the link that'll take you to the Google Drive, and it'll pull up some samples. What I'm most proud of are the ones that I wrote about how to prove a procedure is not experimental, which is one of the reasons I got denied, is because we think this is experimental. And so that information is in my files. Don't stop appealing until you get to level 2, and that's the outside agency. And they will probably appeal you, tell them what you want, and for those of you on Medicare, I got the outside independent agency called Maximus to approve medical necessity for liposuction surgery for me, and you can too. And get a lawyer to represent you. And my time is up, but this is a summary. This is what you need to prove to the review committees that you need this surgery. Thank you.
The title of my talk is Tip and Tricks. This is an old slide from about 3 years ago. Just want to point out to the two figures at the bottom. 3 years ago, Polly did a short questionnaire to the US women who underwent a lymph-sparing liposuction, and only 1/3 got paid eventually, 2/3 not paid. In my opinion, the ratio can be reversed or even better, but that takes a lot of work, as we just heard from Mindy. So the first step, and I'll try to take you through all these steps as myself as a provider. When I get a call from a patient, we have the appointment, we have an interview either in the office, either remotely, and we get a very, very detailed history, examination, assessment, and very detailed plan. At that time, I refer the patients to assessment by other clinicians for any comorbidities, make sure they are cleared for surgery. And I make sure we optimize their non-interventional treatments. Why that is so important? Because first, I don't think every lipedema patient should undergo surgery. Many of them can be very well maintained with good, effective, conservative treatment, and they don't need to go on a liposuction. And the other reason is when you go to the insurance company, eventually you can tell them, and it can be stated, that conservative treatment was conducted, optimized, and it essentially did not result with any significant change of the disease. The optimizing the non-interventional treatment, every patient has to go before we are deciding to treat them. They have to go through a good, thorough evaluation and treatment by a lymphedema therapist. And everybody, all my patients have the book, the nutritional guidelines. If they come to the office, they walk out with the book. And if they don't come to the office, they get it on Amazon. But everybody has to get it and to read it. And everybody has to go through weight loss plan. I always refer them to evaluation by different specialists that relevant to their problem. Everybody undergoes a vascular venous ultrasound just to make sure there's no hidden concomitant venous insufficiency that can cause problems during surgery. I send everybody to orthopedic surgeon because invariably all lipedema patients have knee pains, hip pains, often other joint pains, and I think it will be very important to get the support of orthopedic surgeon that this patient needs a procedure. The process takes about 3 to 6 months to get all these papers ready. And eventually we submit the pre-certification package. It's about, I would say, about 3 pages. It includes my original SOAP note with very detailed plan, what procedure, how many procedures, what we plan to do with every procedure, photographs of the patients for view photograph, where I marked the area that were painful and tender. Every patient writes her own biography related to this disease, just to make it personal, to document how it affects her function in her life. And then we collect letters of medical necessity. Primary care physician, lymphedema therapist, orthopedic surgeon, vascular surgeon, sometimes endocrine, sometimes other, and mine. Within 30 days, we get the answer. But there are 2 problems here. The main problems I think that we have today, it is no lipedema diagnostic code, or what's called ICD-10. And there's also no lymph-sparing lipectomy code for the procedure. There none exist at this point. So what we submit in the letter, we submit the nearest ICD-10 codes. So the most important one is the top one, edema, but it's unspecified. Then local adiposity, hereditary lymphedema, weight gain, abnormal gait, some we have the Dercum's disease if they have. A whole line of diagnosis codes. None says lipedema. And if none says lipedema, it's very difficult to move on. Then what procedure do we submit? So again, there's no CPT code that describe or refer to lymph-sparing lipectomy, like the wall procedure. So we have to put the nearest codes, which the 3 of them I mentioned here. So if there's no code for the disease, there's no code for the treatment. So when the reviewer gets our document, 30-page documents, he puts immediately like 15879. He puts it on what it comes like. It says suction-assisted lipectomy of the lower extremities. Immediately come under the category of cosmetic, plastic, cosmetic, immediately denied. This is a patient who was lucky. I interviewed her in October, and on 3/1, March, I'm sorry, she was approved after one step, just after the pre-certification. She's lucky, but she's really in minority. This is the most typical patient. We first saw her on April, then we had submitted pre-certification, then peer-to-peer review, then first appeal, then another conversation, then second level appeal, and finally in January she was approved. She just had the second procedure yesterday. She's doing well, but it was totally unnecessary. 9 months of suffering, agony, exacerbation of the disease, and you name it. There are 2 main reasons, as Mindy explained so well, for the denial. 2 categories. One is cosmetic. You want just to improve your appearance. It's medically not necessary. And the other category is the experimental. Okay, that's what I get in the letter of the denial, because we submit it from our office. So they say, your case, he said, liposuction can improve your appearance, but does not improve your health. That's a statement for their letter of denial. That's why you are not approved. But look at their own documents, and I'm sure Mindy went through all that, because I love your slides, really. But before that, I write in my letter of medical necessity, element we call it, that the cosmetic improvement is not one of the goals of WAL. And I say further, all these procedures are for correction of major physical impairment, restore basic physiologic functions, and prevent the inevitable complication. So let's go back to the documents, to the policy document. This one I took from, I think it's Anthem Blue Cross Blue Shield. Doesn't matter, they're all the same. So they're defining, what they define, functional impairment when you have problems with ambulation, mobilization, distortion of nearly body part, and a functional impairment can be due to pain, and more and more and more, okay? So that's functional impairment. Then, what they define as medically necessary, medical necessary, and they separate between reconstructive versus cosmetic procedure. So reconstructive is to return the patient to whole, and cosmetic describe improvement of a physical appearance. So then you think, here, I send them the whole document, I prove that the patient has functional impairment, major. So by their own definition, it's medically necessary. Clearly, it's for reconstructive, you expect to be approved. So then, they write in their own document, and why I think I'm optimistic, sort of optimistic, because they write their own document, lipectomy or liposuction is considered cosmetic and not medically necessary when the reconstructive criteria in this section are not met. This section means what I read before. So, if they are met, it means that it is reconstructive. It's medically necessary, right? Simple logic. But then it says next sentence, lipectomy or liposuction is considered reconstructive when done to address a significant variation from normal directly related to surgical mastectomy. Boom. So two weeks ago, I got a phone call to the office from a very nice nurse who called me to tell, sorry, Dr. Shapiro, we had to deny your patient. And I say, why? And she quoted that. I tried to convince her. Why? It's unbelievable. She passed it to her own doctor. She told me her own doctor looked to it for 29 minutes and he denied. They tell me the time is up. So I guess, thank you.